Hello and welcome to Wellness Watch, a show that explores the nuances and burden of illnesses and diseases on mankind and how we in India are dealing with it. Imagine losing your vision bit by bit, not overnight, but so slowly you barely notice. That's the tricky nature of glaucoma, an eye condition that is a silent reminder of how fragile our vision can be, so much so it tests our awareness as much as our eyes. Today in Wellness Watch, we discuss glaucoma, the signs you should not ignore, and how regular eye checkups can save your sight. I'm Preeti Kaur. Glaucoma, often called the silent thief of sight, is one of the world's leading causes of irreversible blindness. What makes it especially dangerous is that it often develops without pain or early symptoms. By the time people notice vision loss, the damage is usually permanent. The good news is regular eye checkups and timely treatment can help preserve your sight. Here's a report by DD India's Harshita Oberoi on what glaucoma is, why it happens, and how you can protect your vision. Glaucoma is a group of eye conditions that damages the optic nerve, which carries visual signals from your eye to your brain. When the pressure inside the eye, known as intraocular pressure, rises, it slowly injures this delicate nerve. Over the time, the damage causes gradual, irreversible vision loss. In most patients, glaucoma has no early symptoms, no pain, no redness, no warning. Gradually, side vision fades away, while central vision remains until even that begins to narrow. By the time it is noticed, much of the eyesight is already gone. While high eye pressure is the main cause, it is not the only one. Age over 40 years, family history, diabetes, hypertension, and long-term steroid medication increase the risk. Eye injuries or previous eye surgeries can also trigger glaucoma. Since glaucoma is usually silent, routine eye checkups are the only way to catch it early. Eye specialists measure intraocular pressure, test side vision, and examine the optic nerve using advanced images. These painless tests can detect glaucoma long before vision loss begins. There are several types of glaucoma. Open-angle glaucoma develops slowly and painlessly. Angle closure glaucoma occurs suddenly with severe eye pain and headache, that is a medical emergency. Congenital glaucoma affects babies, while normal tension glaucoma can strike even with normal pressure levels. Glaucoma cannot be cured, but it can be controlled for life. Treatment includes eye drops to reduce pressure, laser therapy, or surgery to improve drainage. But the key is consistency. Never skip your eye drops, even after surgery, because they preserve the vision that remains. Prevention begins with awareness. After the age of 40, get your eyes checked every 2 to 3 years, more often if you're at risk. Eat healthy foods rich in antioxidants, stay active, protect your eyes from injury, and avoid long-term self-medication with steroids. Glaucoma does not strike in a day. It creeps in over the years. But a single eye exam could change your future. Remember, once the sight is lost, it can never return. Protect your eyes, detect glaucoma early, because awareness is the only cure for this silent thief of sight. Harshita Oberoi's report, Wellness Watch, DD India. All right, so glaucoma does not hurt or gives you discomfort that is unbearable. It creeps in quietly without pain or warning, slowly stealing your vision before you even realize that it's gone. World Sight Day is observed every year on 9th of October to help spread awareness on eye health. An estimated 80 million people worldwide live with glaucoma, which is the second leading cause of irreversible blindness. Projections indicate this number will increase to over 111 million by 2040. A significant portion of cases, at least half of them globally, remain undiagnosed. Today, we look for these answers in the show. What is glaucoma? What are the symptoms? Is glaucoma curable? And what preventive care is to be taken? We also discuss what medical advancements have been made in India. All right, glaucoma treatment in India involves a multifaceted approach, including eye drops, laser procedures like trabeculoplasty and iridotomy, and surgery such as minimal invasive glaucoma surgery, that is MIGS, glaucoma implant surgery, and trabeculectomy. The choice of treatment depends on the type and severity of glaucoma, with the goal of preserving the remaining vision. Up here on the screens, we will get you some hospitals and we'll get you some institutes which particularly address this. Dr. Rajendra Prasad Center for Ophthalmic Sciences, AIIMS Delhi, Safdarjung Hospital Delhi, Sankara Nethralaya Chennai, Sir JJ Group of Hospitals Mumbai, Postgraduate Institute of Medical Research, Education and Research Chandigarh. All right, to help us understand glaucoma better and how severe it can get for people, we're joined in by guests in the studio. We're joined in by Padma Shri Dr. J.S. Titiyal, former Chief and HOD, Dr. R.P. Center for Ophthalmic Sciences, AIIMS Delhi. And we're also joined in by Dr. Dewang Angmo, Additional Professor, Dr. R.P. Center for Ophthalmology Sciences, Delhi, AIIMS. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. To begin with, Dr. Titiyal, I would want you to explain to our viewers in very simple layman terms, what is glaucoma? Why is it called the silent thief of sight?
As you rightly said, glaucoma is the most fearsome disease in the eye. It's a silent thief in terms of taking your vision away. But commonly, if you layman's term, glaucoma is misunderstood. In Hindi, they call kala motia. So sometimes they think it's a motia, like motia is a cataract. So it's not cataract, it's a totally different disease which is basically damaging the optic nerve, which takes a vision to the brain. And is one of the most sensitive structure we have in the eye, otherwise you go blind. And most of the time there will be a high pressure, the intraocular pressure of the eye, which may be damaging to the optic nerve, and that would be irreversible. But if you look into the disease per se, you can categorize the two categories. One is a primary glaucoma, which is there with the people. Sometimes they can have a hereditary genes behind this in a primary glaucoma. As rightly described, it can have an open angle glaucoma or a closed angle glaucoma. And this primary glaucoma is normally adult onset, but sometimes it can be congenital primary glaucoma also. Every age group can be affected by glaucoma. The second part is a secondary glaucoma, which is because of a various disorder in the body or of some disease in the eye, especially inflammatory disorders, autoimmune disorders, or people having some sort of a trauma or a surgery. So this is also an important large segment of glaucoma also. But today we are focusing on a primary glaucoma, which can be treated, which can be prevented, a type of glaucoma. But yes, if you already had a damage, irreversible, but we can prevent further damage happening. For that, we require a proper examination of individual and their family members also.
Right.
And the age group cutoff can be 40 years, because most primary glaucoma are picked up at the age of 40 years. And if you have a closed angle glaucoma, I can say that may be little better, because you have symptoms there. You can have headaches, you can have a blurring of vision, you can have an acute red eye, and those can be picked up early before the damage happens to the optic nerve. And prophylactic treatment can be given in this type of glaucoma, that is called narrow angle or a closed angle glaucomas. There we can do a laser iridotomy, open a small window in your iris tissue, so that the aqueous, which is the fluid which is generated, has to go through a channels which is called trabecular mesoid channels to outside the eye into your conjunctival space, and that can be created. While the open angle glaucoma, there is no prophylactic treatment for that. There you have to pick up the disease and treat to prevent further damage happening.
Right.
So this is I can describe in a brief manner in this way.
That's a wholesome answer.
Yeah.
I'll take that forward to Dr. Angmo. Dr. Angmo, get us more details as to how common is glaucoma these days? So and the particular age group, because sir says it affects all age groups, but the cutoff age is 40 years. Is there any particular age group which is more prone to glaucoma?
So as sir has mentioned that we have for diagnostic purposes, we have divided glaucoma as primary and secondary. So, the primary glaucomas, which are usually age related, they would be arising after 40 years of age. So, after 40 years of age, we anyhow say that opportunistic screening or do a health checkup at least for the eye annually after 40 years of age. This is for the primary glaucomas. But for the secondary glaucomas, means that they can be because of either trauma, or they can be because of some diabetes. It can also lead to neovascular glaucoma if the diabetes is not controlled, or people use topical steroids for various allergies. So, if that is continued using over the counter, they do not take prescription from the prescribed doctors. So, that can lead to a steroid induced glaucoma. So, all these are secondary causes of glaucoma, can occur in early ages as well.
All right, Dr. Titiyal, in our report, we've talked of IOP, the eye pressure. Help our viewers understand what is eye pressure and, how is it related to glaucoma?
No, it's a very important point. Pressure is one. That is, maintains the structure of the eye. There has to be a pressure which is called intraocular pressure, which is normally keeps the eye intact in terms of its morphological wise and the maintenance of its function also. So, normal pressure in adults can be ranging from a 10 to 21 millimeter mercury, and it has a diurnal feature. It does not remain constant throughout the day. It can change morning to evening to night, and this variation should not be more than 6 to 8 millimeter in a daytime in a particular 24 hours. But those people who have more variation, you can have more chances of damaging the optic nerve also. That is one. The factors which changes the intraocular pressure can be 2-3 things. One, the outflow channels are blocked because of various disease, or your aqueous production is much more. So, both the things can cause higher pressure.
Is that natural?
Yeah, not natural. There is a natural process of aqueous formation, the fluid formation, which is taken away from the eye from the trabecular channels. If there is a imbalance between these two, then you can have a uncontrolled pressure which can damage the nerve. But importantly, when you measure the pressure, the one important factor should be mentioned, and people should know that your corneal thickness is a very important factor for our intraocular pressure management. So, we need to know what is our corrected pressure. So, that depends on our corneal thickness, because cornea may be thin, cornea may be thick, or it may be normal. So, whenever you get your eye pressure checked, ask your doctor, is my pressure corrected? You have taken a corrected pressure or not? And when you go to visit an ophthalmologist, whatever age you are, especially if you are 40-year plus, just ask 2-3 things. What is my pressure? How is my optic nerve looking like? What is my field of vision? If you ask these 3 questions, you may be saved by the damage of glaucoma.
Very important information given by our doctor. Doctor, also tell us, does sleep pattern or sleep position somehow, does it also have a bearing on eye pressure?
It may be, especially those people who have the various disorders, like they are suffering from a hypertension or a hypotension, they have a sleep apnea. So, these can affect your intraocular pressure also, and especially if you are taking medications for your cardiovascular disorders, or you are having some drugs like a beta blockers, or you are asthmatic, you are taking some inhalers, they can always affect your pressure of eye. And sleep pattern also makes a huge difference. We know that people would say during sleep your pressure may go down. It may not be true. Your pressure may be high sometimes also. And entire night, it depends which cycle of sleep you are. Sometimes your sleep may be very uncomfortable. Your eye pressure might change there also. So, especially people with a sleep apnea, they should be very careful in this.
All right, ma'am, we've told our viewers in the report that glaucoma slowly creeps in. It is not something that occurs overnight. When is it the time for a person to see a doctor? When the person is looking for early symptoms, one, and once if the vision is lost, we know it cannot be regained. But then, can glaucoma be cured once for all? And if once cured, can a person again get the chance? Has the chance of getting glaucoma back?
So, I'll first answer the
first
part, wherein what are the early signs and symptoms of detecting glaucoma. So, as we have also mentioned previously, that the open angle form of glaucoma is basically asymptomatic. So, in this, the best thing is that after 40 years of age, one has to get a health checkup annually. So that there is when we can see that the intraocular pressures have raised A, and also we can see that the visual field is constricting. So these are the two tests that can be easily done and can be and the fundus examination, which will show that the early signs of glaucoma is there. The second part of your question is cure.
Yes.
Once the glaucoma is there and the vision has hit the vision, whether it's irreversible, whether it's so whatever amount of vision has got lost, that cannot be reversed, because basically what happens is that the optic nerve has axons which takes, and the nerve is the one that is signaling to the brain. So in glaucoma, that nerve basically has been affected. So it's like an electrical wire. So if a part of that wire has gone bad, you have to replace it. So right now, what is the thing is that the technology is not so great that we can replace the nerve. So the only thing is that we can preserve whatever is there. Because from the position of the nerve and the brain, it's a very intricate thing. You cannot actually get into that place. So it's a very difficult, So, but once the treatment starts, whatever vision is there,
it can
that can be preserved.
All right. Dr. Titiyal, what medical advancements have been made in India? Where is India standing on the global page?
I think we have achieved so many things in medical science, and it holds true for a glaucoma per se also. So we talked about intraocular pressure. That's one thing. There are so many other things can be tested and investigated. We have I talked about corneal thickness. Other important things are how do we image the optic nerve fiber layers, because actually this nerve is built by the nerve fiber layers, which are coming from the retinal nerve fiber layer. So we can pick up the early damage before the changes happening in the optic nerve or fields. Those are called perimetric changes, and that is basically by OCT examination, ocular tomography investigation, which gives a section of entire retina, gives layers of optic nerve. It also gets into a cellular level also. Like we can pick up the ganglion cell damage also. We can count the number of cells and thickness. So these are perimetric. Therefore, this test is very, very important to pick up people before anything happens. That's why not only intraocular pressure, go for an investigative diagnostic test, which are based on a OCT and perimetry tests together. And this is a new advancement. Apart from that, in treatment wise also, we have so many groups of medications, and they lower intraocular pressure by 40% sometimes. It's a huge achievement. You don't have to go for surgery all the time. Surgery is normally kept to us as a secondary or a last resort in many of patients. But there are a group of patients who come from very far off places. They can't come back for a re-checkup, or they because medicines are costly and they have to put for a lifelong. It becomes a huge cost to the family also. So sometimes surgery can be one-time surgery, and it can manage the patient's profile also. But I would say it's not a complete cure for a glaucoma. You have to have a regular checkup every year. Today you have a normal pressure after surgery or drop. The things can also change. As we talked about normal tensive glaucoma also. There may be so many other factors. Your vascular supply is getting difficult, and your physical activity may be difficult. Those things are, it's one of the, you can say, thing which has to be managed comprehensively, not by drops. Your physical activity, your psychologically, everything has to be managed.
Right. Also, Dr. Angmo, can lifestyle changes, or to what extent does diet have a bearing on eye health?
Definitely, diet has overall diet, having a good diet has overall benefit to the overall health. And secondly, for the eye, having a good diet with green leafy vegetables, with a lot of antioxidants, all these are very good for the nerve itself, because these antioxidants are important for the regeneration of the optic nerve head. And apart from that, physical exercises, again physical exercises is good, because again it's making you healthy. All your negative toxins which are inside the body, that are all getting flushed out. So definitely physical exercises is also important role in getting you a healthy eye. So it does help in improving the overall
yes,
eye health.
I think if I can add,
yes,
yoga also has a significant advancement in the treatment of glaucoma also. It is helpful for various parts, but glaucoma also it helps because it can decrease the intraocular pressure in the patients also.
Right.
It can control your systemic blood pressure. It can control so many release of your internal you can say steroids, and that would also control. So there are certain practice of yoga people have advised, a lot of research done by AIIMS New Delhi also.
Yes.
So that is also helpful. So if you are doing yoga, please carry on doing yoga, which is good for a blood supply to the optic nerve.
Alright, so
Don't do if you have a glaucoma, never do a sirsasana or which increase the pressure towards the neck side also. Do something which gives you more air and a blood supply to eye, not putting a pressure on the eye.
All right, so important tips put forth there by our doctors. Today we are discussing glaucoma, and up next we'll have a quick rapid fire round, a kind of a myth buster round. I request my doctors to give very quick, crisp answers. Dr. Jeevan, you can get only glaucoma if you have high eye pressure. Is it so?
Not true. You can have glaucoma otherwise also. You can have a normal tension, even low tension also you can have glaucoma.
Dr. Angmo, there is no reason to treat glaucoma if you have no symptoms, especially since there is no cure anyway.
No, that is incorrect. You have to, if you don't have the symptom, you have to get the eye checked up with a proper checkup. If you detect it early, when the damage is only 10 and 20%, your 80 to 90% of the vision will be preserved, which is a big thing. And definitely we need the preservation, we need the eyesight for our living.
Yes. Dr. Titiyal, if you have 20 by 20 vision and no symptoms, you will not develop glaucoma at any point of life.
No, you can develop glaucoma any point of time, especially if you have a family history of glaucoma, family history of diabetes, you are diabetic yourself, smoker, if you are not doing activity, physical activities, and you are obese, you can always have a glaucoma.
Individuals affected by glaucoma cannot wear contact lenses. Dr. Angmo.
No, that is not true. Contact lenses are not contraindicated in patients of glaucoma. However, if certain surgery is done like trabeculectomy, wherein the contact lens may not fit, however, in the modern day and era, we have the minimally invasive glaucoma surgeries, wherein the patient can still continue to wear contact lenses even after the surgery.
A person with glaucoma can do intense activities. Dr. Titiyal.
Yes, yes, they can do activities, but as I said, you should avoid something which can, increase the pressure of your eye, like avoid taking steroid without the, doctor's prescription, and don't do sirsasana, that is, should be avoided.
Avoided. Glaucoma can be cured with surgery, Dr. Angmo.
Yeah, definitely. If we do the surgery, the intraocular pressure reduces. So there is a treatment for glaucoma. However, whatever the vision has got lost, that cannot be recovered post surgery.
But the remaining vision can be preserved.
Yes.
Thank you so much, both of you, for joining us this afternoon on Wellness Watch and helping us understand glaucoma better. So after this wholesome discussion, we did understand that sight is one of life's most precious gifts, and protecting it begins with you. Glaucoma does not announce its arrival, but you cannot stop it from taking over. Get your eyes tested, spread the word, and help others see the light. Remember, your eyes deserve the attention just as much as the rest of your health. On that note, we end this discussion here. Thanks for watching Wellness Watch. Bye-bye.